Hello, everybody. Welcome to the National Patient and Family Engagement Learning and Action Network Kidney Caregiver Peer Connection Call. We appreciate your interest in this topic. Today's call is meant to be an informal way for caregivers to ask questions of other caregivers who have experience with the kidney disease journey. Before we get started, there are a few items we'd like you to remember. All lines are currently muted. The lines will be unmuted after we introduce our panel of caregivers. Please be respectful when asking questions and do not speak over someone else. We also ask that you take the call in a quiet location and mute your phone lines when you are not speaking. This call is being recorded and will be made public on the NCC website. We will also promote it on social media. Please do not disclose any personal identifiable information. Do not share any information that you would not want to make public, such as your date of birth or the name of your dialysis facility. Please do not ask for medical advice. The role of the panelists is to share their personal experiences dialyzing at home. If medical advice is given or asked, the NCC will interject in the conversation. Each person's situation and experience is unique. The treatment plan for each patient is unique to their personal needs and various factors, including other medical conditions. Before making changes to your health practices, speak with a member of your healthcare team. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. For those of you joining us by WebEx and you have a question at any point, please send it to all panelists using the chat feature. We will read your question in the question and answer period. So, the views and opinions expressed during this call are those of the panelists and do not necessarily reflect the official policy or position of the ESRD NCC or the Centers for Medicare and Medicaid Services. Any content provided by the panelists is of their opinions and is not intended to substitute for professional medical advice, diagnoses, or treatments. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. I will now turn the call over to my teammate, Ms. Kim Bittner.
Thank you, Jerome. For those of you joining us by WebEx, you now see a photo of the NPFE-LAN team. I am Kim Bittner, as Jerome introduced me, and we work with a group of patients with end-stage renal disease and their caregivers to design and spread practical approaches that can be used to help other patients become engaged in their health and care to improve the quality of life. I can have the next slide, Jerome. Thank you. We have selected a group of 3 subject matter experts from the LAN group to answer your questions and share their individual experiences. We would like to thank them for agreeing to join us today. Now, we won't go into their history or stories as caregivers too much because we want them to be able to share their experiences directly with you. First, though, I'd like to introduce Brenda Taylor from Illinois, who has been a caregiver to her husband, who's a caregiver to her husband, and is a caregiver to her daughter, both of whom have experienced in-center hemodialysis and transplantation. We also have with us Donn Bellmore, who's from New York and was a caregiver to his wife, who began with in-center hemodialysis and through her journey used peritoneal dialysis, transplantation, as well as home hemodialysis. And then we also have Natasha Bress, who's from North Carolina and is a care partner to her husband, Keith, who is currently using home hemodialysis. I'd like to welcome everyone to the call, and again, thank you for your time. Now, before we take questions from the callers, I'd like to ask each of you about your most memorable moment as a caregiver? And I thought we could start first with you, Brenda. So what was your most memorable experience being a caregiver? Brenda?
Hi, can you hear me?
We can hear you.
Okay, thank you, Kim. I would have to say that my most memorable experience as a caregiver was the satisfaction and the gratification that I got having the opportunity to take care of my family. Oftentimes, caregivers are driven by their heart of compassion, and they want to support their loved one in their health journey. And so we know that caregivers tend to experience a higher level of mental and physical health than most people do. So on one hand, I was really happy and I was grateful that I had a chance to be there for my family and provide them with the support that they needed. Then on the other hand, I found myself battling with the mixed emotions that came with that, with my own challenges that came as a result of me caring for my family. And so finding a way to balance that process was by far the most memorable experience in my journey.
Thank you for sharing that, Brenda. And hopefully, as we go through some of the questions, we can find out how you balanced some of those emotions. So we appreciate you sharing that with us. And at this time, I'd like to ask Donn the same question, if you wouldn't mind sharing your most memorable experience as a caregiver.
Oh, not at all, actually. I think my most memorable time out of the whole journey was when we started home hemodialysis. Elaine was very sick, and the training was totally overwhelming the first day. The second day, I learned how to access her fistula. And the third day, it was my turn to access it. And I was pretty scared. I got everything all set, got all ready. And at the last minute, I stopped and I was saying a little prayer. My wife says, "What are you doing?" I said, I'm saying a little prayer. She says, "Donn, just do it. I trust you." And I did it without problem. And that was the start of us treating her at home.
Wow. I think that was a great memory to share, Donn, just that the relationship and the trust that you two built together. So thank you very much for sharing that with us as we kick off this call.
Oh, you're welcome.
And Natasha, what is or was your most memorable experience being a caregiver?
I guess I have a couple, but one would be the first time we had to train for home hemo, because before that we had done pretty much in-center or it was PD, and I'm terribly afraid of needles and blood, and going into training, my husband kind of downplayed a little bit part of my involvement and that I wouldn't be very much needed as far as the needles were concerned. His nurse definitely let me know that I would need to know some things, and I had to practice with helping him with the insertion and taking out the needles, the cannulation, and it was very scary, and I did almost pass out. But since then, I'm pretty comfortable with it now, and I would have never thought I would be at that place where I could be comfortable around needles of any sort.
Wow. Thank you both, Donn and Natasha, for sharing that moment. We've heard from patients about the fear of needles, and but you brought in a different perspective of with the caregivers and a fear of needles, and just how you've been able to overcome that and working together with your loved one. So that's a great perspective. So we appreciate you sharing that perspective.
Thank you.
You're welcome. Thank you.
Absolutely. So before we get started, we do have a few questions that we received ahead of time, but I also want to check with Jerome to see if we've received any through the chat box so far. And we want to remind any of you who are on WebEx that you can submit any questions you might have to just send them through WebEx. And so we can ask those questions as well before we open up the lines for conversation. But Jerome, have we received any questions so far through the chat?
Yes, Kim, we received one, and that question is, what do you do to maintain balance in your life?
Good question.
I'd like to speak to that a little bit. This is Brenda Taylor. That happened to be one of my biggest challenges because when I started caring for my husband, it was years ago, and there certainly was not a whole lot of resources available to caregivers at that time. And so a lot of the things that I did was by trial and error. And so just checking in with myself to see what I needed, to see when I felt like I was at the other end of the spectrum. I would implement small things. I would begin by, I didn't feel comfortable leaving my husband or my daughter at a certain time. And so I just go in the other room and I put on music. Eventually I felt comfortable with that. I'd go out for a walk. Eventually I felt a little more comfortable with that. And then I was able to actually take a respite break. And so it was small things that I was able to do to just sort of take care of myself when I needed during the process.
Donn or Natasha, would you like to answer that question as well?
I would, yes.
Okay, Donn.
The opposite. When my wife first started her journey, I should say our journey, she was on home PD and she was quite capable. As a caregiver, my biggest job was moving supplies and helping her get things ready, but she pretty much took care of everything, and I had stuff shipped all over the country as we traveled, but she did pretty much everything herself. But as we got older and she got worse, on in-center dialysis and then home hemodialysis, I couldn't leave her very long. So I had to find a way to take care of myself while taking care of her. And that might be just quiet time every day, maybe just before dinner, or, just something that I could do by myself to relax and think. Music, read a book, whatever, for a half an hour, 45 minutes. And that's how I maintain balance. You have to take care of yourself.
Yeah, thank you, Donn. Natasha?
Yeah, for me and my husband, a lot of what we try to find balances is kind of how to sometimes separate the care partner relationship and being like, a normal married couple and doing things outside of dialysis. Sometimes we do get bogged down, I think, by it. It's a big part of our life, and as it should be, but just making that space for the two of us is important. Separate from that, as well as for myself, also just like being able to like Donn mentioned, having those moments away for everything and just that quiet time. Both me and my husband also see a therapist separately and together, and that helps as well.
Good point.
Thank you for sharing that, Natasha. We just got a comment in the chat box, and it stated, good reminder, Donn, self-care is so important, especially when you are caring for someone else. So thank you, Kimberly, for sharing that with the group. We also received another question, and they asked, have any of you used a caregiver support group?
I have not. This is Natasha. I didn't even know, I guess, when I became a big part of this, about any other caregivers at all. I don't really have any close by, so that's why I was really interested when I was asked to be a part of things like this, just to get to speak to other people who are going through the same thing. So for me personally, no, I have not been a part of any support groups.
Okay. But like you said, doing something like this does help, just getting out there and talking and sharing with others and learning from others. So excellent point. Brenda or Donn, is there anything that you'd like to add or share?
I've actually been a part of a support group. I actually have a support group where we meet virtually and we meet in person, just to kind of get together and talk about the challenges of caring for loved ones with stage renal disease, and to talk about informal conversations and so that we can support each other. So yes, I do have a support group, and I am a part of a support group.
I didn't have a support group. There wasn't any available to me at the time. I found the biggest support was within the in-center dialysis caregiver family. I mean, we always ended up waiting there together, having lunch, talking, and sharing. And when I left that, I mean, when Elaine and I left that and went to home hemo, there was no support group. So I recently started one on Facebook for a lot of the caregivers in this area now. And we share experiences and stuff. It's not real active because I think a lot of people just, they don't want to take the time for it. But there's a few people that are pretty active in it. So it helps. It helps everybody.
Well, thank you for mentioning that, Donn. When you started, you talked about how you connected with people within your wife's facility, and there may not have been a formal support group as we had, as the question had asked, but you were able to connect with others and find that support there. And it sounds like you're able to kind of do that, just within your community now as well, or previously as well too. So those are good suggestions too, to kind of reach out to people who might just be available and talk and share experiences, just as what we're doing on this call. So thank you all for those suggestions. Jerome, have you received, or were there any other chat questions?
Yeah, we did get one, and this is for all of the caregivers on the call. How can others show you that your care is appreciated?
Can you repeat that, Jerome?
So this person wants to know, how can others show you that your care is appreciated. So is there something, the person that you're caring for can do or say to let you know that what you're doing for them is appreciated?
Well, this is Brenda Taylor. During my process, and I think that's why it was such a positive experience for me, just hearing those words mean a lot. There was probably not many days that would go by, especially because my husband had been on dialysis and had renal failure for a long period of time. And toward the last 10, maybe 5 to 10 years of his life, there was never one day that went by that he wouldn't say something like, well, I really appreciate you doing this, or, thank you for this. So a lot of times just hearing those words really make a difference. At one time, he knew that it was a challenge to leave them alone, and it was him that would suggest, go take some time for yourself, take a day and go out and spend it with your family, with your sister. So, just gestures like that really shows that the person is aware of what you're doing, and and their ways of saying thank you.
For me, it was fairly similar. I mean, when I had to start taking more care of Elaine, she always made an effort to let me know how she appreciated it. And when I didn't quite want to leave her alone too long, she would insist that I would go do something. Even if it was to go to the store, or at one time she even made arrangements for the kids to take turns coming in, so and the nurse, so that I could go on a weekend getaway. And I hated to say no to that, but I did. But the thought of her doing that for me was tremendous. But she never failed to let me know how much she appreciated it.
Well, for me, it's more of just, I think Brenda might have mentioned it, but just the thought, the words. My husband tells me all the time that he really appreciates everything, I do for him, that I'm there. And I've had people kind of ask that as well. And honestly, when people are like, it must be a lot of work, or it must be a lot of this, I don't really think of it that way. It's definitely great to feel appreciated, but I wouldn't be anywhere else but with him and by his side through any of it. So he's very thoughtful about everything when his treatments are. If we want to plan something, he definitely makes sure, that his treatments are done and we can enjoy ourselves without that having to worry about it. He makes sure to get everything planned. So, yeah, things like that.
Well, it sounds like you all have some very generous and loving people in your lives. So thank you for sharing that. We did get another question in the chat, and it says, what type of support do you need from your adult children or extended family members? What specific things have your family done that you found especially helpful?
If I may. Oh, I'm sorry. Go ahead.
Oh, go Well, for me, during the time when both my husband and daughter was on dialysis, probably the last couple of years of his life, it became very extreme, and so I've always had a problem during this process asking for help. But a couple of my sisters I reached out to because things got really rough, and they would do things like, because they both went to dialysis on the same day during the same time, and they would have doctor's appointments. She would call me, and she would say, well, can I take she would take my daughter to her doctor's appointments, or she would go and pick up prescriptions. There was a time when she needed a procedure done, outpatient procedure done, and she went and she sat with her. Things like that meant so much to me. It was priceless. And just having someone there, to know that if I needed them, that they were there, and those gestures went a long way.
Donn? Donn, you're muted now.
Can you hear me?
Yeah, we can hear you now.
Okay. For me, my kids are all grown, and when Elaine started getting pretty bad and what have you, a lot of times one of the kids would feel free to provide support, company, what have you. A lot of times they would help out around the house with me, and do things like that to free me up for other things. And then they had no problems coming and visiting their mom and allowing me to do a couple of things that I had to do. Go to the store, go shopping or whatever, or my doctor's appointments. So to me, that meant a lot. They couldn't help treat her, but they could allow me to have free time so that I could get other things done. So to me, that meant a lot.
Thank you, Donn. Natasha, do you want to answer that question?
Sure. We don't have any children, but our extended family have been really great. Keith's mom, her fiance, has been on dialysis and has had a transplant, so she was a really big help with everything, and especially when I and Keith started dating and engaged and got married. She was a really great source. My aunt also was a caregiver to my cousin for dialysis as well. So she's also a great source of just someone to talk to about everything. And then our friends are really great. Whenever Keith has a procedure, especially if it's a few nights in the hospital or something like that, my friends are definitely, and his friends are willing to, if I need to go home, to just take a break and come in and sit with him and stay with him, and or bring food, and so we don't have to worry about our watching dog if we need it. So just that kind of support has been really great.
Great. So we are now going to open up the lines to give all of our call-in users an opportunity to ask questions. So again, we ask that you take the call from a quiet location. If that's not possible, to please mute your line so that we can avoid as much background noise as possible. So I am now going to unmute all the lines. All right. So the lines are unmuted. Does anyone have a question for our panelists?
Jerome, I do want to ask them this. When the caregivers have attended family events like family or going to someone's home, say after church, or go to a party, how have you helped the patients dietary restrictions?
So I believe the question is, when you've been invited to a family event or an outing, how have you helped your loved one with the dietary restrictions?
Well, I would offer gentle reminders. But my wife was a stubborn Irish woman who pretty much followed the rules most of the time. But when it came to a special occasion or something special like that, she much did what she wanted to do, regardless of my reasons. So I couldn't argue with her because she was good at all the other times. So you got to live once in a while.
How about you, Natasha? Do you have to sometimes step in and, I guess, your husband about what he's eating?
Yes, often. He is a very big snacker, and so he really likes a lot of sweets and things with sugar, and his nutritionist gets on him all of the time. So whenever we go out, I do try to make him aware of the things that he's eating, or just make sure he's taking his binders like he should be as well with his meals, and every time he eats. It's still a work in progress, though, I will say, for sure.
Okay, and I think this question is also for Natasha. How has, this is from one of our, came in through the chat feature, how has COVID-19 impacted your caregiving routine?
It really hasn't impacted us too much. I will say, as far as me, I'm more anxious to do anything. I still am, my job has been open the whole time. I work in property management. Our doors have been locked, but I've been very outspoken with my job about, meeting with residents and things like that, what I'm not willing to do, just for the sake of, I still have to go home and I have someone at home who is compromised. And so I have a lot more anxiety when it comes to going out, grocery shopping, and things like that. As far as just our normal day-to-day, it hasn't been too bad. It's just kind of the things that we were used to doing, and things we still have to do, go out into the world. I just tend to get a little bit more anxious about that, but we're just trying our best to just to stay safe with everything.
Any more questions from our call participants? We do have another question in the chat box, and I believe this is for any of our panelists. What general comment would you make to caregivers to encourage them when things may have gotten tough?
Can you repeat that? I'm sorry.
Sure. What general comment would you give to a caregiver to encourage them when things may have gotten tough?
Oh, gotcha. I would just tell them that, there will be tough moments. That is not a maybe, it's a fact. But just making sure that the lines of communication are open and that you feel okay to ask questions, that you feel okay to ask questions to the dialysis team, that I ask questions all the time. I don't care if they sound silly. I want to know. And sometimes just in regards to, being a caregiver, it can seem like a large weight sometimes. And it seems heavy, but that, you're doing this and you're here for that person that you love, and, it's going to be okay.
And one of the things that I would always do also when things would get rough, I would always bring myself back in by reminding myself why I'm doing this. That would always give me perspective, and just kind of keep me centered as to why, why I'm in this situation or why I chose to do this. It would always give me perspective. So that's always a good question to ask yourself too.
Yes. If I may add something, I always believed that the best way to help my wife was to be a patient advocate for her. She didn't always understand some of the medications and stuff like that, so I always tried to help her out with that. But when things got really tough, I was never afraid to reach out to family members just to talk. Our pastor, friends at dialysis. Sometimes just having somebody to listen to you is very meaningful. Don't be afraid to ask, and don't be afraid to talk to somebody.
Thank you, Donn.
We have one last. Sorry about that,
Jerome. No, go ahead.
Yeah, we have one last question, and we're going to start with Brenda. And we'll go Brenda, Donn, and then Natasha. What advice would you give someone starting their caregiving journey?
The first thing I would say would be to get as much information as you can, become informed on what the process is going to look like, ask plenty of questions, and to also get an understanding from the patient's care team on what's expected, what you think is expected of them, and to see what sort of support is needed. I think that it's very important for you to build a relationship with the care team, especially with if your loved one has centered dialysis, so that you can ask the right questions, so that you'll know about their labs and their diets, and just having that communication is extremely important. And then educating yourself as a caregiver is very important.
Thank you, Brenda. Donn?
I agree with everything that Brenda said. I would emphasize being involved with the care team and educating yourself and the patient with everything concerning the process, the illness, and make use of all the resources available. Knowledge is power, and a lot of times that's very helpful with the care team. And to remain active with your patient. The care team will answer your questions more enthusiastically and show a little bit more care if they know that you are very active in your patient's care.
Thank you, Donn. Natasha?
Pretty much everything that both Brenda and Donn said. Educate yourself, just being informed, get close with your care team. I have multiple people's phone numbers, and if I feel like I'm at a loss of something or scared about something or need assistance, I am quick to call. And they are nothing but great and are willing to answer any questions I have. Again, just, it's a lot of, going to the appointments and being available and, just learning that sometimes you might need to be flexible because it's always changing and things are always happening. But just being open-minded.
Well, Brenda, Donn, and Natasha, thank you all for being with us this afternoon. We really do appreciate you taking the time to share your experience, your thoughts, your words of wisdom. I'm sure they will be and are helpful to the many patients that are on the call and who will review this recording. So thank you very much.
Oh, thank you.
Oh, thank you.
You're welcome. Thank you.
So for more information on caregiving options, please visit any of the websites listed on the screen. The websites include the ESRD NCC, the American Association of Retired Persons Family Caregiving, Caregiver Action Network, ESRD Rockstars, Family Caregiver Alliance, and the National PACE Association.
The ESRD NCC has developed, with assistance from patient subject matter experts, the kidneyhub.org. This is a secure, mobile-friendly web tool for patients and professionals. So we invite you to visit the kidneyhub.org today on your mobile device and access links to important resources such as COVID-19, infection prevention, transplant, home dialysis, as well as new ESRD patient education. We also have new features added regularly, and we recently added access to the patient grant library and included informative videos about understanding high KDPI and increased kidney risk. So when you visit the mobile device, or when you visit this on your mobile device rather, please be sure to bookmark it on your device's home screen, and then this way you'll have easy access to all of these resources right at your fingertips. Jerome?
There are several ways to contact the ESRD NCC, either by email, and the email address is nccinfo@hsag.com. Our telephone number is 844-472-4250, and our mailing address is on your screen. We also invite you to follow the NCC on social media. You can find us on Facebook by liking ESRD National Coordinating Center, or follow us on Twitter at ESRD NCC. We are also on YouTube. You can search ESRD NCC. Thank you all for joining us. Have a good day.
Thank you. Everybody have a good day.
Thank you. Have a good one.